All right. My name is Anielle, and I am a Louisiana Nurse Political Action Committee Board Trustee. LANPAC is conducting interviews with candidates for our state legislature. We want to learn more about where the candidates stand on issues important to nurses and the health and welfare of our citizens. LANPAC solicited input from the nurses in our state, and then the LANPAC board finalized questions from the top issues submitted. These questions were sent to our candidates prior to their interview. I'm delighted to welcome Madison O'Malley, who is running for District 91 for state rep in our state legislature. Candidate O'Malley, I would like to turn it over to you for brief opening remarks prior to us moving forward with questions.
Great. Well, good morning. Thank you very much for having me. I'm excited to chat with you all and definitely you. I decided to run for the state legislature after I started a small business, and I worked to do many inspections in homes after Hurricane Ida. So I work with a small team. We worked on behalf of the attorneys that were filing claims and did a lot of the inspections and reports together. So it was through doing that I learned what the actual impact of the insurance crisis was on the district, but on the city and the state. Obviously, the insurance crisis has to be fixed in the legislature, along with the Commissioner of Insurance. We may be going into a special session on that. But I see the homeowners insurance as being incredibly impactful for small business owners here. We've seen a lot of them close because of the rise of the insurance, as well as renters. And then obviously our homeowners are hit hard with it. You have young people who can't afford to buy or are leaving the city. So I see this as just a huge issue that we've really failed to take action on. Before I did that, I actually worked in healthcare. So I graduated school from Loyola here, and then I started working in the emergency room as a scribe. And so I worked at the Ochsners, I worked at Ochsner Main and Ochsner Baptist, as well as out in Kenner, and scribed, and then went back to school to get a biology degree. And after that, I actually worked for doctors as a technician at a surgery center. I worked at Metro GI here for a small group of doctors. And then most recently, I actually coordinated care for patients. I was their referral director, and we worked with a lot of the underinsured and uninsured patients, as well as the workers' comp department of patients. And then just through doing that, we noticed a lot of gaps in the insurance realm in our healthcare world. And it was just through seeing a lot of the Medicaid patients that were not able to have specialty care. I was working in pain intervention. So none of the pain intervention procedures are covered by Medicaid. And then we saw a lot of mental health patients as well, and finding mental health providers, finding where people can get treated for pain intervention procedures here is very limited, as well as looking at our neurologists and what the availability is of appointments and all of that. So it kind of opened my eyes to how the state legislature would be applicable in healthcare, especially when we're talking about reimbursements and access to care and providers. And so it all came full circle when I decided to run. I'm running in House District 91, which has been redistricted and picks up a lot of new territory and loses a lot of new area as well, or loses a lot of old area, I should say. It goes from Napoleon to the CBD, sort of the middle area between true uptown, and then the downtown area. It covers Central City, Broadmoor, and Blue. So we started campaigning earlier this spring, actually in March. And then I was able to get a lot of walking, a lot of community stuff done throughout session, and have just been on the ground since. We have a very strong field game that we've been working on right now. And now we've been phone banking, and we have like a full scale operation, I would say 6 days a week for the past 12 weeks. And so I see the impact of that and have had a ton of fun.
Thank you for those remarks. Now, question 1. Prior to COVID, we recognized healthcare services are not accessible on an equitable basis nationally and in Louisiana. Healthcare is only 20% of what accounts for one's health status, and social determinants of health are the non-medical factors that influence health outcomes. What strategies do you have to assist with reducing social determinants of health impact on the citizens of Louisiana?
Awesome. I think a lot of this comes to the quality of life issues and definitely our public safety, crime issues, poverty issues. When I think of like particular things that coincide with healthcare, I think of like our um, primary care system and how we're lacking primary care providers and how we need to be encouraging those relationships. Something I'm particularly interested in are the value-based models in primary care. And I see and have worked with a few of them that are for senior patients. And so I don't know what your thoughts are on that kind of billing model, but I see a lot of community centers and community health centered work being so important to being a little bit more holistic about how we deal with healthcare.
Thank you. Now, question 2 is about the faculty shortage in education. How would you advocate for federal and state funding to support recruitment and retention of nursing faculty to reduce the nursing shortage?
Yes, I definitely think that the Department of Health, we need to advocate for this on. We need to make sure our state institutions are helping train more nurses and train more providers in the system. I'm definitely supportive of advocating for any kind of federal funding to do that. I think it's very important. Clearly, after the pandemic, we can see what shortages and where we're at. So I think it's a public health concern. We need more professionals here.
Thank you. Question 3 is around safety and violence, and this is actually like the two-part question. So, gun violence continues to roar through our community, schools, houses of worship, shopping malls, grocery stores, etc. What factors do you see as critical to bringing an end to these senseless acts? Do you have a strategy to address this problem?
This, I think, again, comes with really working with education. Right now, I know that there's been an effort, especially in healthcare, for nurses and doctors and healthcare folks to educate families and educate children more so. So I'm supportive of that and definitely think there needs to be the awareness, more of like the public health concern with gun violence. I'm supportive of any kind of methods to limit gun ownership. I'm supportive of any kind of permitting and strengthening of the laws to make sure that we have fewer guns on the street. And I just see this as being incredibly important in this district, just because we've seen so many violent episodes lately. And so I think people here are very supportive of it. I am incredibly supportive of whatever we can do to limit our gun violence problems.
Thank you. Here's the second part. Rapid fentanyl test strips can be used to determine if drugs have been mixed or cut with fentanyl. With important information about fentanyl, healthcare providers can take the steps to reduce the community risk of overdose. How would you support legislation to make rapid fentanyl test strips more readily accessible?
I'm very, very supportive of advocating for funding for this. I think the better we can diagnose and the quicker we can find out what's wrong is more efficient and it's better for outcomes.
Thank you. Question 4 is around access to care. Are you supportive of actions to remove arbitrary barriers that prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full extent of their education, licensure, and training?
Yes, I'm definitely supportive of making it easier for us to gain more providers here, making sure that people can practice, especially up, like you said, up until their education. And I just think that especially in rural areas, this is very important to us in addressing maternal health care crisis, provider shortages there. So whatever we can do to kind of help our healthcare system and help ease the burden of that.
Thank you so much. The next two questions are about just general questions. The first one is, what are your legislative priorities?
I think about this in three parts always. I know we kind of addressed the insurance crisis, but definitely the insurance crisis legislation there is like very, I think I have a lot of ideas and have been talking a lot about reinsurance and mitigation and inspecting before. And so insurance is its own little portion. After that, we get into public safety and funding with public safety in this district. Um, Definitely supportive of all the infrastructure work that can be done. That's a huge concern of constituents, and it's been largely ignored. And then finally is education. Education is probably most important to me. I went to public school my entire life. And so whatever we can do to gain early childhood education funding, as well as the job and technical training funding. There's only one school right now, I believe, in the district that I've talked with that is offering a certain portion for the technical training. And I see this as being a great need. So I'm very supportive of expanding that.
Thank you. Next question and the final question. Why should the Louisiana nursing community support you as the best candidate for the legislative seat?
Yes. Well, first, I worked in healthcare. So I worked with many nurses, many different people in healthcare. I love the healthcare system. I see the healthcare system as being actually very relevant to the legislature, as we've seen, especially after the pandemic. And so I'm a partner whenever it comes to healthcare. I think we have great improvements to make here, and we have the way and the means to do it in many ways. We just need to put the right minds together to do that. So first and foremost, I worked in healthcare. And then the second thing I would say is I'm very collaborative in nature. That's why politics and the legislature is so appealing to me. I love to work with people. I love to get to know people, and I like to get to know the issues so much. So that would be the two strongest reasons.
Thank you. Candidate O'Malley, I would like to give you 2 minutes to give closing remarks.
Great. Well, I will say I think the legislature not only needs a strong voice in Baton Rouge, especially from this district, but one that can actually be effective on many of the biggest issues facing us right now. The three most important things and the three things I hear the most at doors when I talk with people are addressing the insurance crisis, addressing public safety concerns, and then helping with whatever we can do with our public education. None of those three things have been addressed in the legislature from this district. There's been no legislation sponsored or passed on any of those notes. So I see the most important things is addressing what people's main concerns are. My favorite thing to always ask people and to ask anybody in politics is what is important to you. So I've led with that. I've had a lot of fun running, and definitely want to ask for your support. And I'm glad to be here and be introduced.
Thank you for taking time out of your busy schedule to share your responses. Good luck with your campaign, and you have a good rest of the day.
Thank you very much.
Bye.